Okay, welcome to today's issue of the AKT 30-day challenge. So less than a week to go now, so let's start as ever with a high yield question. Here we go. So correct answer here is E, a 4-month-old baby with a temperature of 39.9 degrees Celsius. It's a very tricky question because all of the others here are high risk, and this question was specifically asking about moderate to high risk. So NICE stratifies risk in suspected sepsis into 3 categories. So there's low risk, moderate to high risk, and then high risk. Okay. So some of the features to be looking out for when you're suspecting sepsis, and it's important to document these in the medical records. So things like behavior, respiratory features, circulation and hydration, skin, temperature, and then a few sort of that don't quite fit into that, the other. So let's look at some of the important features. So if we start with behavior, one of the worrying things would be sort of no response to social cues. Okay. If we look at respiratory, tachypnea, and depending on the age, this is what we'd consider to be tachypnea that's risky. Here we go. Apnea, grunting, having SATs less than 90% on air, these are all high risk. And then in terms of circulation and hydration, bradycardia less than 60 beats per minute at any age is worrying. And then tachycardia, and what we'd consider tachycardia depends on the age range. So let's have a look at the cutoffs. Capillary refill being 3 seconds or more would be worrying. In terms of the skin, we'll be looking for things like mottled or ashen skin, cyanosis. Of course, a non-blanching rash is worrying and would warrant an urgent admission for assessment. So temperature, which is one of the features that we looked at. So temperature of 39 or more in a 3 to 6 month old is considered moderate to high risk. This was the feature that was in this question. Under 3 months, then a temperature of 38 degrees Celsius or more is considered high risk. And then at any age, a temperature under 36 degrees Celsius is worrying. And then in the other category, things that don't quite fit into this, so things like leg pain, having colds, hands and feet, these are moderate to high risk features. Okay, so sepsis is a really important topic, and acute problems, emergencies in primary care, specifically acutely unwell children, was one of the features that was highlighted in a previous exam as an area that people struggled with, so it's worth revising these things. Now, we've got less than a week to go, as I mentioned earlier. It's really important. By this time you might be feeling a little bit fed up of looking at textbooks, of reading. So what you want to do is you want to make the most use of these last few days by being efficient. Go through the curriculum checklist. Any areas that you don't feel confident in, do some focused reading on those areas. If you haven't already done so, you might find it useful to sit down and do a full mock exam so that you see the pressure of time, you can work on your time management and exam technique, but there's still enough time that if you identify any areas that you need to work on, you can quickly recap those. So I hope that's been useful. Just keep pushing. Every question, every extra bit of reading will make a big difference. You're nearly there now. And you know, all that hard work is going to pay off. Just keep it going. You're going to get there. You're going to get through this exam. So do join us again tomorrow for another high yield question. Thank you.